This is
between the two needles, it's a very high voltage being applied, up to 3,000 volts. And when you apply such a huge voltage, what happens is destabilize the cells, cell membrane, and it creates nano holes inside the cell membrane. Okay, it's literally creating holes inside the lining covering the cells. With these holes appearing in the cell membrane, what happens is that the cell basically just like commits suicide. They die because it's a bit like, you know, if you have multiple holes in your skin, all your fluid in the will just leak out. This is the same kind of scenario.
Four weeks later, that tumour had reduced in size by 2 centimetres, and the sensation that I was getting from it, the sort of sharp pains before the procedure, I now no longer get, and I can see myself that this is shrinking in size. So it's pretty early days yet because the procedure was only 6-7 weeks ago, but I'm fairly hopeful that after 3 months that we'll see a significant reduction. I am being monitored by determining whether the tumours are smaller or stable, and that for me is good enough. So smaller or stable would be great. Gone, of course, would be excellent.
Yes.
I'm obviously concerned about his diagnosis, that's why I'm correctly diagnosing him with ECG all the time.
The data we have shows we do have, you know, we can control the disease, but it's certainly not a cure. And it is, certainly in the case of pancreas, we would certainly advise to be used in combination with chemotherapy. So that's where we are seeing some survival advantage. I mean, if you look at the data from America and also from our data, we're already almost kind of doubling the time to progression and also the overall survival. In terms of survival for the pancreatic carcinoma, the median survival, even with the best of the chemotherapy, you're talking about 13 months, 9 to 13 months. Whereas with combination with the Nanoknife, you're extending it to 20, 23 months. We are really looking at patients that have exhausted conventional treatment, and that's how we would proceed at this stage, because there's no, as I've said, there's no formal clinical trials that really look at its proper efficiency or efficacy. But what we know at the moment is that this is a very safe technique, and we are allowing patients to go through the conventional treatment first.